An estimated 90% of people experience back pain by the time their retirement age. We are going to go through and explain the complications and the details of the anatomy of the back so you understand this clearly.
More importantly, we're going to show you 5 different activities you can do at home to stop your back pain. Some of them are exercises and some of them are stretches.
We've narrowed down these exercises to 3 effective methods, and it's posture, decompression, as well as motion. Okay, the next thing I'd like to do is clear up the title about the 53 different points in the spine. This is really interesting. The spine is probably the most complicated part of the body. It holds the spinal cord, the peripheral nerves, the spinal nerves that come out, as well as muscles, ligaments, discs, and facet joints. Let's look at it a little more closely. So here we got the spine. We're not talking about the 7th cervical spine. From here to here, okay, at this point there's actually 34 facet joints. Can you point those out a little bit, Mike? We'll go a little more detail.
The facet joints are on the lateral aspect here between each vertebrae, and this is a common area where you're going to feel your arthritic pain if you're having any in your back.
Right, and they're on both sides, so 2 per segment. Okay, the next thing is 17 discs, and you turn it around and show the disc between each vertebra. We've got a disc. There we go. Those are a very common point for pain, irritation, and of course the spinal cord we mentioned. Now on these we don't have the ligaments and the muscles, but they're all there, and I could even go into more detail as far as number. But the whole point is not the number, but how complicated the spine is, and it's so amazing that we don't have back pain all the time, but the body takes care of itself, and if you follow the instructions on how to maintain it, it is amazing how it's going to work for you.
That being said, all the components to the spine, it's very possible there are numerous different issues going on. However, these exercises will help fix a lot of them.
That's right. I do want to clear one thing up. When someone says, oh, I've got arthritis in my back, I want to look at this, and we got a close-up here. You see the red, that's a facet joint right there. That red represents some irritation of arthritis. That's where the arthritis is in the facet joints, not in the muscles, not in the discs, but it feels like it's all over everything, but that's the source. All right, now what I'd like you to do is we're going to customize, actually you're going to customize the exercises for your spine. Everyone's spine's a little different, has different problems, and there's 5 different exercises. What you will look for is when you're doing the exercises as we instruct them, if they create pain, particularly any sharp pain, you're going to mark that exercise in the don't do list. Just put it away. You may be able to come back to it later, but for now you put it away. Go to the next one. If the exercise feels good while you're doing it, and then afterwards you stop and give it a minute or two and it continues to feel good, that's good. Even get up and walk around. That's the green light on that exercise. You're going to put that exercise in your to-do list. Do that for each one. After you have that, you'll have your to-do exercises and the ones that are a little painful or they're just difficult to do. And then you'll start doing your exercises on a daily basis as long as they continue to feel good. So don't overdo it. Take your time with these. It's customized to you, and this is a really good rule for success. All right, the first exercise is when you have back pain and, it hurts and maybe you've done something to irritate it and you want to give it a break. This exercise emphasizes decompression as well as posture. Ideally, you'll do this on a carpeted floor, and a bed will work. That's okay. The firmer the surface, the better outside of a hard floor because it's just uncomfortable. So Mike is here. Use a thin pillow, and the key for this is twofold. One, you need to put pillows. I've got 3 of them here. So we have slight flexion of the hips. That takes some pressure off of the low back, puts it in a neutral position, gapping the facet joints we talked about, as well as relaxing the muscles, good posture in the upper body. And also, this is one thing I personally do, or I have my patients do, is take a cold pack. Unless you prefer heat, you can put a hot pack, and you place that under that back. allowing those muscles to relax even more. If there's some inflammation in there, the cold pack is going to help draw that out. Now, one step better than the pillows is one of these. They're called a leg wedge. You put that there, and they just work better. There's something about the angle here. You bring it up till it makes contact with your thighs at your hamstrings, and it really, Mike, how does that feel to you?
Feels good. It's a nice consistency. Sometimes with pillows, it's a little oblong depending upon the shape of the pillow.
Right. And we don't have any affiliation with these. We just know they work from our experience personally as well as in the clinic for 20 to 30 years. Mike, do you have anything else to recommend for these people?
So this can help with a range of back issues, but primarily if you have stenosis or spondylolisthesis like Brad does, typically a slight flex posture like this helps. It can also help with other things, but just give it a try. It's a nice decompression and relaxing thing. And Brad called this an exercise, but I think it's just relaxation.
Well, if it's an exercise, then you can say you exercise every day like Danny was saying.
On to number 2.
Let's go to number 2, yeah. All right, the next exercise, this one is going to address, again, decompression as well as motion, particularly to the low back. We're going to show 2 options, one lying down and one seated. Go ahead, Mike, in the supine position.
So you can start with bringing just one knee up to your chest and stretching this way. However, some people like doing double knee right away, so that's definitely an option if you would like. Now, bring both knees as far up as you can comfortably, as long as it's not causing back pain. And you can hold this here for 30 seconds. You can just stay put. You can do little rocking oscillation motions, whatever feels good. You're just trying to stretch out those muscles, open up those facet joints we talked about.
Right.
And this commonly helps with stenosis again or spondylolisthesis. But if it helps your back pain, just give it a try.
Right, it stretches those muscles out, particularly that quadratus lumborum muscle is responsible for pain. If you have a hard time reaching over your knees, simply reach underneath. Some people find that much easier as opposed to reaching over the knees, depending on your body proportions, etc.
Yes, and you can also use a belt underneath here if needed.
Right, that's a nice option as well. Okay, now you can do this in the seated position. Well, it's always good to do in a firm chair, not in a soft, cushy chair in the living room. So we're going to start out here, and we're just going to lean forward. I've had people bring their knees apart and fingertips to the floor. Again, when you do this, you should feel relief and a very healthy stretch back here. If you do this and you have problems breathing or it creates pain in your back, do not do it. And that will happen with certain people with the breathing and whatnot, depending on your body structure. So you can down and up, do that 3 to 5 times. If you want to stretch to one knee, this way will stretch the left side of the back. If you go this way, it'll stretch the right side of the back. Again, 3 to 5 repetitions at a slow pace. Follow the rules of no pain, or if you have pain, you stop doing it. Very good. Anything else to add to that, Mike?
It's the same concept as what I'm doing. He's just bringing his upper body towards his lower body, where I'm bringing my lower body towards my upper body.
Yep, it's the same thing, just different. All right, let's go to the next one. Okay, this next exercise is primarily motion. It really gets those facet joints moving, gets the synovial fluid, good for arthritis in the back, and loosening up those muscles. You do it in this position. We call it quadruped, or simply hands and knees like this. You can do it on a bed. Best to do it on a firm surface like the other ones. Now, some people call it the cat, camel. Some people call it the cow, cat, I don't know. But in this position, Mike is going to arch his back down. So we're going this. So the spine goes in an arch like this. Head comes up. And then you don't hold it there and push it really hard. You just go to a comfortable end range, we call it. Now go ahead and hunch up. Whoa, look at that. See, to me, this is the camel, but Mike says it's the cat.
This is the cat.
Okay. Whatever it is, hold that for a few seconds and simply oscillate back and forth. Now, if you get pain when you go way up, simply avoid that range. This is where the customizing comes important. Let's say that it hurts only when he's up like that. So, Mike, I want you to customize this, do the same thing, but only go halfway up. So there, little pain starts, then go back down. And that's okay even if you minimize it to 50 or 25% of normal range. Give it time and loosen things up so after a few days of doing this, you get to your full range of motion pain-free.
Motion.
That's speech
New
thing.
words.
Anything else to add to that, Mike?
No, just go slow, controlled. Make sure to breathe through it and be very relaxed.
All right, that breathing is so critical. Relax breathing.
I usually inhale when I go up like this and exhale when I push down and arch my back.
Good. Major tips. Good points. All right. That takes care of that. We're going to the next one. Okay, this next option is decompression or traction. Now we're showing 3 different options depending on what equipment you have. It's very minimal. If you have a stick, a piece of dowling or PVC pipe, it should be about 5 feet long, and it's helpful to have a rubber tip, but you don't have to. We're going to show you an option. You can actually use a broomstick if you would like, but it needs to be relatively solid. 4 to 5 feet long, preferably 5 feet or more. Go ahead, Mike. We're going to show it standing and a seated option.
So in a standing position, you're going to have it on something a little taller in order to reach up high enough with your shoulders. Again, if you do not have a grip on the handle, you could put it in Brad's shoe or your own shoe because Brad's shoes stink. So you're going to reach up as comfortably as you can with your shoulders. Now, once I'm up here, I'm going to let my knees bend, keeping my hands in the same place, and this is going to put some traction on my spine and give a nice relaxing feeling. You want to try to keep as straight of a back as you can. You don't want to, it's kind of hard to flex over and do this. So just keep a nice straight back, decompress, hang out as long as you can comfortably, and then relax. And you can go on and off a few times and do this throughout the day. Maybe you're walking and you have to have a walking stick. You can do this on a park bench to get some pain relief.
Yeah, if you're one of those people that don't mind people watching and staring at you, but make sure you take your time with this. Do not get into it. And again, if it does not feel good or you don't feel steady doing this, do not do it. We do not want to cause a mishap by slipping on the stick or whatever it may be. The chair is probably the easier way to do it. Let's go to that, Mike.
Okay, to perform the traction in a seated position, you can put the pole on the ground like this, but for me, I can't reach high enough. This pole is too short. If you're going to do that, make sure to put it in a shoe so it doesn't slide around, decompress this way. However, for me, I can reach a little higher, so I'm just going to put this on the chair itself. Again, reach up as high as you can comfortably, and then I have to kind of lean forward and pull with my arms while trying to leave my buttocks relax and stay on the seat. This is giving a nice distracting feeling as well.
Notice the good posture he has here, so it's working posture with that decompression. Again, now if you have shoulder problems with this and it's uncomfortable to bring your arms up that high, you simply cannot do the traction with any of these methods. So that's important to understand. Don't try to wreck your shoulders to fix your back. We don't want to have a lose-win situation. So keep that in mind. And now the next option, if you have a pull-up bar at home, I'm using hanging handles like we have here. Anything that you can grab that's safe. It has plenty of strength and you can grab onto it. And it works well if you can go against the wall. You don't have to go against the wall like I am. It works better, but if you have a pull-up bar and you're free hanging, it's okay. If you have to jump up to get to the bar, it's too high. You need to get up on a step, on a stool, or something of that nature. I would just not do it because we don't want unsteady things going on. So if you have a setup like this and you slowly let your body weight go through your shoulders and into your spine, you'll feel your back decompress. Now, if this starts to hurt, you stop. If it feels good, like right now, my shoulders feel good. I actually do this consistently 3 to 4 times a week and oftentimes more. Feels great on my shoulders. And when you first start, you probably won't go full weight bearing. You won't lift your feet up. You'll just feel it out. See how it goes. 5 or 10 seconds is all. Get up. See how it feels. If it feels good while you're doing it and after you get up and move around, that's the green light. And go ahead, do it more. After a week of doing this, only 3 days a week, don't do it every day right away. After each day, it should feel good the next day. Then, if you start on Monday, then Wednesday, go ahead and do it again. You can hang a little longer if everything feels good as a result of the Monday session. And you may go feel good. And sometimes some people will actually do a little bit of gentle movement with their hips or their knees. Again, it has to feel like good motion. Never hang longer than 30 seconds is my personal rule. And typically when you start out, 5 to 10 seconds is good. Progress it to that 30 seconds over a matter of a few weeks. So very cautious with the hanging. It is a little more aggressive, but it can have really good results. Okay, now we're going to move on to the last one. This was pretty much strictly posture, but posture and the spine go hand in hand if you want a healthy spine, pain-free. We're going to do a simple exercise in the seated position. We call it the W's, or I do anyways, because I'm from Wisconsin and this is the W. So in the chair, like Mike has it, do a firm chair. It's not going to be on a nice, soft, cushy chair in the living room. Probably a kitchen firm chair. And you can see Mike actually doing this now. He's going to breathe as he does it. The W comes up. He's breathing in through the nose. Exhale out the mouth. And as he does this, he's going to think about bringing his chest out, arms back, and back here, his scapulas or shoulder blades are actually squeezing together. That really stretches the muscles out here, which are typical for getting tight and getting this posture. We want this posture. So that's the W for win.
Yes, this is really going to work the upper part of the spine, your thoracic region compared to your low spine, but it's great posture exercise to do. And one more tip about posture, if you're sitting in a chair that's more worn out or the seat pan is too deep and you feel yourself constantly sitting like this, what you can do is simply put a pillow behind you in a vertical fashion and then just put that there and it'll help with this.
Right. That's actually, that's one of those things I've just kind of ran into in the last month with Bob and Rick, another therapist. But yeah, it's comfortable, it feels good, and it promotes good posture.
And you can do your W's with a pillow now.
There you go. All right. There you go. Pick your exercises accordingly. Mike, do you have anything to finish up with?
Just do what feels good for you. Skip the ones that don't, like Brad mentioned earlier, and hopefully your back will start to feel better.
That's right. Good luck with everything and good posture.